All right, Krystal, what's on your radar?
Well, New York hospitals are restarting elective surgeries along with other locales around the country, even as the coronavirus pandemic, of course, continues to rage. Now, some of what are called elective surgeries do actually have a level of necessity and urgency to them, but the rush to restart, not strictly a choice of medical necessity. As Politico wrote about New York's reopening, hospitals say now that the procedures scheduled before the coronavirus took hold in New York may have been elective at the time they were scheduled, but after months of delay are gaining in urgency. Also urgent for many hospitals is the dwindling revenue from one of its most lucrative practices, which have been on hold downstate for more than a month. Indeed, there seems to be quite a rush to get back to those elective procedures, even as many hospitals are actually short on critical personal protective equipment and actually having to reuse masks in certain cases. As one worker told the Daily Beast, "It's safety over profits. I would rather be dealing with these economic troubles than be diagnosed with COVID-19. Now, I want you to think about this. We are in the midst of a pandemic. Hospitals overloaded with patients. Bodies are piling up in refrigerated trucks, and our frontline medical staff in COVID-19 hotspots, they are stretched and stressed to the breaking point. But profits in the healthcare sector, they've actually plummeted, in part because those high profit margin elective surgeries have been pushed off. In fact, as economist Justin Wolfers pointed out, healthcare spending overall has plummeted, accounting for half the decline in GDP growth in the first quarter, leading to a healthcare-led recession. Now, it's logical in a way, since we spend way more per capita on healthcare than any other developed nation, which, of course, any sane person would think was a terrible thing. But it's a great thing if you're just looking at GDP growth, just looking at stock performance for the health industry public companies that have found world-beating ways to gouge the public. It exposes some of the fictions that have been built over decades around our healthcare industry, that it's somehow at its core really charitable and benevolent, when the truth is honestly quite unsurprising. It's built around whatever makes business sense, not necessarily what makes public health sense. Hence the rush to get back to those high profit margin elective procedures. That rot has been revealed by the crisis, but let's be clear, it wasn't created by the crisis. The fundamental contradiction between healthcare profits and the public good has long been a dire issue. And it's being exposed in another way as well. Remember all that debate in the Democratic primary about Medicare for those who want it and how horrible it would be if Americans had to leave their wonderful private health insurance to shift instead to Medicare? Questions were always framed around the disruption involved in Medicare for All. Never once did they contemplate the disruption, bankruptcy, and immorality of the current system. But now, unfortunately, all of those things are undeniably manifest for all to see. As millions upon millions lose their jobs, millions upon millions are also losing their health insurance, which is kind of inconvenient since we're in the middle of a pandemic. In fact, the employer-based healthcare system that Biden and many others are looking to maintain is crumbling before our very eyes. According to The Guardian, last year, 160 million Americans were covered through their jobs. Now, a new study from the Robert Wood Johnson Foundation and the Urban Institute found that up to 43 million Americans could lose that health insurance thanks to the mass layoffs that we are, of course, watching unfold in real time. That is catastrophic on every level. It will actually be crushing to the healthcare profit bloat machine, and obviously it will be devastating for the families who have to live in fear of dying avoidable deaths and becoming another medical bankruptcy statistic. What's remarkable, however, is that millions lose their health insurance even in normal times. DC just hadn't really bothered to notice. Here's what the numbers look like. In April, a catastrophic 17.2 million people changed from employed to unemployed. Those are mind-blowing numbers. But actually, it's just a normal year in America, where every year 17.3 million Americans flow from employed to unemployed. The pain now is so sudden, it's so intense, and it's so outrageous in the middle of a pandemic that, of course, we have to take note. But the pain is no less real for those millions facing job loss and health insurance loss in a normal year. However, it's rendered completely invisible, and intentionally so, honestly, by those who profit off of the status quo. A new ridiculous article is out painting Biden as the next FDR, citing as proof in part the fact that he's calling for free coronavirus testing and treatment. Oh, wow. What a bold move that would actually just serve to help preserve the current broken model that costs us more money than anyone with worse results. Millions are losing their health insurance. Our entire system of care is corrupted by bloat. But at least if you get coronavirus, you may not have to declare medical bankruptcy. You get some other illness? Well, sorry, but then it's not politically advantageous for us to give you care. If this pandemic hasn't opened your eyes to the expensive disaster that is our healthcare system, I don't know what will. And Sagar, here's what you realize, right? Voters in every Democratic primary in the country said they support Medicare for all. Those numbers have only gone up logically because they're looking at these numbers and going, you know what? Having your health insurance tied to your job, this isn't such a great thing right now. And yet the Democratic establishment, and Joe Biden in particular, have not budged 1 inch. Why? Well, look at who funds them.
Yeah, it's
right?
about money.
Look at who they serve. That's absolutely right. I mean, Joe Biden, for this ridiculous that we talked about already, FDR, he's going to be the next FDR thing. He's already said he would veto Medicare for all if it even came to his desk. That's how far he's gone to say absolutely not. We will never do that.
I think people need to understand the titanic sums of money that are involved here, right?
Yes.
Like literally hundreds of billions of dollars per month. And that is what the hospital industry is. And that's one thing that is always just kind of missing from this discussion. But as you point out, we're in a healthcare-led recession. How does that happen? It's because the hospitals have to shut off the only profitable part of their enterprise, which is elective surgery, which means how have we created a system where actually just delivering point of care to sick people is not profitable? That tells you everything you need to know.
Right.
It's all this other stuff. It's the, drugs for conditions that aren't life-threatening. It's, care surgery, elective surgery. Look, some elective surgery is absolutely needed. I'm not denigrating that.
Yeah.
But what I'm saying is that the hundreds of billions that these people make all comes from that wing of healthcare. That's where all the innovation is. Like, people talk about innovation in American healthcare, and they're not wrong. Like, if you have a very rare cancer, we are probably the only country that will be able to treat that. However, if you're just sick and you want regular cheap care, you're actually not going to get that in a profitable system through our hospital system. And I've diagnosed this very much as it's the same story of so much of the rest of our economy, which is Obamacare led to mass consolidation amongst all of these hospitals, and that these mass hospitals were able to team up with the insurance companies and screw over everybody else. They raised the jet premiums, go sky high, and at the same time, they have complete monopolistic control over what they charge for an actual piece of healthcare, which makes everything fake. There's not a single price in healthcare which is real.
No,
not one.
First of all, the people are like, oh, the free market. I mean, first of all, it's not a free market. So let's be real.
It's the most highly regulated,
concentrated
monopolistic market in the world.
All kinds of bizarre, this thing costs this much here, this much, all because of, bizarre, procedures that they use to try to squeeze as much out of you or out of the health insurers. I mean, it's just all a game. So let's just say that. But really, when you put profit at the center of your healthcare system, you are going to get really bizarre and crazy outcomes. For example, as I point out, healthcare is such a large part of our economy, in part because they have gotten so good at gouging the federal government, the American taxpayer, and you, especially if you are uninsured. So it accounts for this massive part of our economy. That's why, and that's where all the incentives are aligned within a profit-driven system for that to be the case. That contributes to GDP growth, right? That contributes to increasing stock prices because they're able to increase their profit margins. It does not lead to having the best system to keep you healthy or treat you in the midst of a pandemic. I mean, it really is that simple. And what's amazing to me is, for all their pats on the back here that they think they're so smart and so brilliant, they seem to have their eyes closed to this dynamic where the American public, especially right now, increasingly sees what's going on, recognizes we need a more radical response. And if you're not going to take a more radical approach now, when are you going to? It's unconscionable that in none of these relief bills, such as they are, that have passed, none of this has been contemplated at all. No. That was one of the first things that I think it was David Day and one of our great guests on the bail pointed out, why is no one talking about healthcare? There is a health crisis. We're in the midst of a pandemic. It is being exacerbated by the fact that millions are getting laid off of their jobs and losing their health insurance. And we're not doing anything about it.
And that's the other thing. It's not coming back. And this is the great myth of a lot of these. I mean, both Democrats and establishment Democrats and Republicans seem to be united on the idea that we're just going to have a V-shaped recovery. That we just need to have a bridge to get back to when businesses. It's like, guys, that's not coming back.
It's a fantasy.
Economic response at this point, until we have reliable therapeutics and a vaccine, we're running at a 75% economy. We need to realize that. There's only one way to fix that: a massive fiscal response. And to get to the broader point of what you show in this entire thing shows how Medicare and the hospital industry are joined at the hip in order to bilk everybody. Because what they do is they take the Medicare dollars and then they can charge whatever they want in many cases. Medicare is not even allowed to bargain with the drug companies over the prices that they pay for these things. So the drug companies get to set the price and they know they're going to get paid back. And it's just like this over and over and over again throughout the whole system. And it's a teaming up of these two industries in order to screw everyone. And that's why we pay so much money and don't get very good healthcare in the same process.
Yeah.
And that's everybody ever says we have the best healthcare in the world. Yeah, it's true. But at only at certain levels. I mean, you will get the best healthcare in the world, and you also might go bankrupt.
And by the way, and there's just so much mythology within the whole healthcare industry. One of the things we've talked about here is the drug companies, right, and all their patent protections all build around this idea, we're doing critical life-saving research. No, you're not. Federal government has actually funded most of in fact, all of the new molecules that have been invented in the last decade have all been driven by public funding. What the drug companies mostly do is they do some slightly new formulation of some highly profitable drug. It's not something that's going to be useful during coronavirus, because in these potential situations, the chance that you're going to make money off of this drug for this rare potential outcome or disease is so small, they're not investing in that stuff. They're investing in the next version of Viagra or whatever, things that they know they can take to the bank. So a lot of that mythology, I think, is being blown up right now during this time.
Yeah, I think that's right.
Sagar, looking forward to your radar. That's next.